What's up, everybody? It's your boy Dr. Mike for MedEd Essentials. Get ready to dive deep into the fascinating world of medicine with our brand new series, Factastic. We're talking about those weird, wacky, and sometimes even unbelievable facts about the human body and the crazy things that can happen to it. From the common cold to something more serious, we're going to break it down for you in a way that's easy to understand, entertaining, and maybe even a little bit funny. So buckle up, hit that subscribe button, and get ready to explore the amazing world of medicine with Factastic.
All right, guys, let's talk about the common cold. We've all been there, right? Stuffy nose, sore throat, feeling like you got hit by a truck. It's the worst. But here's a fun fact. Did you know that the common cold is actually caused by a virus, not bacteria? Now, I know what you're thinking. Dr. Mike, why does it matter if it's a virus or bacteria? Well, my friend, it matters because antibiotics, those magical pills we love to pop, only work on bacteria. So taking antibiotics for a cold is like trying to fight a fire with a water gun. It's not going to do anything. The best way to fight a cold is to let your body do its thing. Drink plenty of fluids, get some rest, and maybe indulge in a little bit of chicken soup. And hey, if you're feeling really rough, there are always over-the-counter meds that can help relieve your symptoms. So next time you're feeling under the weather, remember, it's probably a virus, not bacteria. And whatever you do, don't go asking your doctor for antibiotics.
Let's talk about our eyes for a minute. More specifically, let's talk about myopia and hyperopia, or as they're more commonly known, nearsightedness and farsightedness. Basically, myopia means you can see things up close really well, but things far away are a blur. On the flip side, hyperopia means you can see things far away crystal clear, but anything up close is a struggle. So what causes these vision issues? Well, it all comes down to the shape of your eye and how well it focuses light onto your retina, which is like the screen at the back of your eye. With myopia, your eye is a little too long, or the cornea, that clear dome at the front of your eye, is too curved, so light focuses in front of the retina instead of directly on it. With hyperopia, it's the opposite. Your eye is a little too short, or the cornea is too flat, so light focuses behind the retina. The good news is both of these conditions are easily correctable with glasses or contact lenses.
Okay, let's talk about sprains. You know, those annoying injuries that happen when you twist or pull a ligament too far? Yeah, those. Now, ligaments are like strong fibrous bands that connect your bones to each other, kind of like nature's duct tape. They're tough, but they can only stretch so far before they say enough is enough. And that's when you get a sprain. So, what happens when you sprain something? Well, imagine those ligaments getting overstretched or even torn. Ouch, right? That's why it hurts so much. You might also experience swelling, bruising, and have trouble moving the injured area. The severity of a sprain can vary. You can have a mild sprain where the ligament is just stretched, or a severe sprain where it's completely torn. Trust me, you don't want a severe sprain. So, how do you treat a sprain? Well, remember the acronym RICE, rest, ice, compression, and elevation. Of course, it's always a good idea to see a doctor to make sure it's not a fracture or something more serious.
Alright guys, let's talk about a topic that might make some of you a little uncomfortable. GERD, or gastroesophageal reflux disease. So what exactly is GERD? Well, it's basically when the acidic contents of your stomach flow back up into your esophagus, which is the tube that connects your mouth to your stomach. Think of it like this. You know that little flap at the bottom of your esophagus that's supposed to keep food down? With GERD, that flap, called the lower esophageal sphincter, gets a little lazy and doesn't close properly. This allows stomach acid to sneak back up, causing that burning sensation we all know as heartburn. Now, occasional heartburn is no big deal. We've all been there after a big meal or a few too many slices of pizza. But when it happens frequently, like more than twice a week, that's when it starts to become a problem, my friends. Chronic GERD can actually damage your esophagus over time, leading to some not-so-fun complications. So if you're constantly popping antacids, or you're experiencing symptoms like chest pain, difficulty swallowing, or a chronic cough, it's time to see your doctor. The good news is, GERD is usually treatable with lifestyle changes and medication.
Let's talk about headaches, those pounding pains in your head that can really ruin your day. We've all been there, right? But did you know that not all headaches are created equal? That's right, there are actually different types of headaches, each with its own set of causes, symptoms, and treatments. The most common type is the tension headache, which feels like a tight band around your head. These are usually caused by stress, muscle tension, or poor posture. Then there's the migraine, which is a whole other beast. Migraines are often characterized by intense, throbbing pain, usually on one side of the head, and can be accompanied by nausea, vomiting, and sensitivity to light and sound. Another type is the cluster headache, which is less common but much more severe. These headaches occur in clusters, meaning you get multiple headaches over a period of days or weeks, followed by periods of remission. They typically cause intense pain around one eye and can be accompanied by a runny nose, watery eyes, and facial sweating. So how do you know which type of headache you have? Well, that's where a doctor comes in. They can help you identify the type of headache you're experiencing and recommend the best course of treatment. Remember, headaches are common, but that doesn't mean you have to suffer through them. With the right diagnosis and treatment, you can get back to living your life pain-free.
All right, let's talk about fever. We've all been there feeling hot, sweaty, and miserable. But before you reach for the fever reducers, let's take a moment to understand what fever is and why our bodies do this crazy thing. First things first, fever is not an illness in itself. It's actually a symptom, a sign that your body is fighting off something more sinister, like a viral or bacterial infection. Think of it like this. Your immune system is like your body's internal army, and fever is like raising the heat on the battlefield. When those nasty germs invade your body, your immune system kicks into high gear, releasing chemicals that cause your body temperature to rise. This increase in temperature actually helps to slow down the growth of those pesky germs and gives your immune system a fighting chance. Now, I know what you're thinking. If fever is so helpful, why do we try to bring it down? Well, here's the thing. While a mild fever can be beneficial, a high fever can be dangerous, especially in young children and infants. A high fever can lead to dehydration, seizures, and other complications. So, it's important to monitor your fever closely and seek medical attention if it gets too high or doesn't come down with medication. Remember, fever is your body's way of fighting off infection. It's not always a bad thing, but it's important to know when to intervene and seek medical advice. Let's talk about hair loss, a sensitive topic for both men and women. It's normal to lose 50 to 100 hairs a day, but more hair in your brush or shower drain can be concerning. Hair loss can be caused by various factors. Genetics is a common cause. Hormonal changes like pregnancy and menopause can trigger hair loss. In men, it's often linked to a hormone called DHT. Stress, poor diet, and certain conditions can also contribute. The good news is, hair loss is often treatable. Consult a doctor to determine the cause and explore treatments. There are solutions to help you regain your crowning glory. Let's talk about something we all hate: vomiting. It's messy, it's uncomfortable, and it can really ruin your day. But before you swear off food forever, let's take a moment to understand why we vomit and what's actually happening in our bodies when we do. First things first, vomiting is a reflex, an involuntary response that your body uses to get rid of something that's irritating your stomach or intestines. Think of it like your body's emergency eject button. There are a bunch of things that can trigger this reflex, from food poisoning and stomach bugs to motion sickness and even stress. When your brain senses that something's not right in your gut, it sends signals to your stomach muscles to contract and your esophagus to relax, which forces the contents of your stomach up and out. Now, while vomiting is usually harmless and often resolves on its own, it can sometimes be a sign of something more serious. If you're experiencing severe vomiting, bloody vomit, or vomiting that lasts for more than a day or two, it's important to seek medical attention right away. In the meantime, there are a few things you can do to ease the discomfort of vomiting, like sipping on clear liquids, avoiding strong smells and foods, and getting plenty of rest. Let's talk about cancer, a word that strikes fear into the hearts of many. It's a complex and often misunderstood disease, and there are a lot of myths and misconceptions surrounding it. Cancer is not a single disease, but a group of diseases characterized by uncontrolled growth and spread of abnormal cells. One common myth is that cancer is always a death sentence. Advances in treatment have significantly improved survival rates. Early detection and treatment are crucial. Another myth is that cancer is contagious. This is absolutely false. Cancer cannot be spread from person to person. Remember, cancer is not your fault. Certain lifestyle factors can increase risk, but many develop cancer despite healthy habits. By debunking myths and promoting accurate information, we can empower ourselves to make informed decisions. Knowledge is power. Stay informed, stay proactive, and seek support. There are many resources available to help you navigate this challenging journey. Together, we can fight cancer with knowledge and hope. Let's talk about something we don't usually discuss in polite company: constipation and diarrhea. These two digestive issues might seem like polar opposites, but they're actually two sides of the same coin. Constipation is like trying to pass a brick. It's characterized by infrequent bowel movements and abdominal pain. Diarrhea is like a non-stop water slide for your bowels. So what causes these digestive dilemmas? Stress, lack of fiber, and certain medications can throw your gut out of whack. The good news is that both constipation and diarrhea are usually temporary. If you experience persistent symptoms, see a doctor. Keep an eye on your gut health and seek help if needed. That's it for this episode of Factastic. We've covered a lot of ground today, from the common cold to cancer. Remember, knowledge is power, and the more you know about your body and how it works, the better equipped you'll be to make informed decisions about your health. If you enjoyed this video and learned something new, give it a big thumbs up and subscribe to MedEd Essentials for more Factastic content. And don't forget to hit that notification bell so you don't miss out on future episodes. Until next time, stay curious, stay healthy, and keep those brains engaged.